My name is Barbara Vinograde, and I serve as the Executive Director of the Iowa City Free Medical and Dental Clinic. The Free Clinic was established in 1971, and what that means is this year we are celebrating 50 years of operation. Our free clinic is the second longest running free clinic in the United States. In the clinic's 50 years, it has been through some changes, but the organization's mission has remained the same: to provide quality, comprehensive healthcare services for the uninsured and underinsured in Johnson County and surrounding areas. Over the years, many of our patients have told us that if the free clinic wasn't here, they would either go without needed care or delay care for as long as they could and then go to an emergency room. And obviously, when that happens, acute and chronic conditions can become much worse. We provide care for a low-income and very diverse population, all of whom share the challenge of not being able to afford needed care. Most of our patients are employed in low-income jobs that don't offer insurance. Most of our patients have families. If people in North Liberty are interested in accessing our services, the best way for them to learn about us is to visit our website, which is freemedicalclinic.org. They are also more than welcome to call our business line, 319-337-4459. If people are in need of an appointment, they should always call our business line to set up an appointment, as we are not a walk-in clinic. We do require appointments because we work with so many volunteers, and sometimes our hours vary. Our clinic is very fortunate to receive strong local funding support. We receive funding through the United Way of Johnson and Washington counties and Johnson County. We also receive funding to the City of North Liberty, to the City of Iowa City, and the City of Coralville. Local businesses, churches, and service groups support our work. Funding is also received through grants. We hold fundraising events throughout the year, including our signature fundraiser, which is called Friday After Clinic. We also receive private donations. We're fortunate, as I mentioned, to have many strong local funding supporters, but we're also very lucky to have many in-kind partnerships that we've developed over the years. These include partnerships with many UIHC departments and colleges. Through these partnerships, staff, faculty, and students come to the free clinic to provide patient care. We have an in-kind partnership with Mercy Radiology, through which our patients are able to receive free off-site orthopedic x-rays, mammography, and ultrasounds. Steinler Orthopedic Clinic provides our patients with 5 free orthopedic clinics every month. We've had many partnerships over the years with Johnson County Public Health, including a partnership through which our patients are provided with HIV counseling and testing. And currently, we have a partnership with Johnson County Public Health, through which we offer in-house COVID-19 vaccine clinics. Annually, the free clinic receives over $1.5 million of in-kind services, including medications, labs, radiology procedures, medical supplies, and volunteer hours. Through these partnerships, we are able to provide our patients with over $5 worth of care for every $1 we receive. Individuals and community groups can support the clinic's work in several ways. Financial donations are always welcome. We also have a wish list on our website, which includes supplies that people can donate. Groups can always do a fundraiser for us. And if people go to our website, there is a section on how people can volunteer. There are many opportunities, and sometimes they vary depending on the time of year, but people are more than welcome to check out the volunteer positions available at the clinic. Like all healthcare practices, our clinic was significantly impacted by the COVID-19 pandemic. The pandemic required our service delivery to change, but the good news is we remained open. Prior to the pandemic, we worked with several hundred volunteers to maintain social distancing, and due to our building size, we had to minimize the number of volunteers and volunteer providers coming into the clinic. This limited the number of clinics we could hold, and it also increased the staff responsibilities. Since the pandemic began, the need for our services has increased due to many people losing their employment and sometimes their insurance. I'm very, very proud of our staff and our volunteers who have worked very hard to allow our services to continue. It has been and continues to be challenging, but again, our community has really helped us to keep going and to continue our mission. Despite the changes we've had to make, last year we were able to serve 1,222 patients during 6,273 clinic visits. 68 of our patients last year were residents of North Liberty. The free clinic is fortunate to have many community partnerships with other nonprofits. We also have a partnership with the Free Clinics of Iowa. The Free Clinics of Iowa is a nonprofit that works with all the free clinics in Iowa. They offer resources and we receive some free funding through them. We also have a wonderful partnership with the Iowa Department of Public Health. We participate in a program they offer called the Safety Network, through which we are able to receive many medications for our dispensary at no cost. We have a partnership with the Noon Lions Club and Lens Crafters, through which we can provide our patients with eyeglasses and eye exams. We make referrals and receive referrals from many other area nonprofits. These include Shelter House, the Mobile Clinic, Proteus, DVIP, RVAP, the Healthy Kids school-based clinics, Iowa City Compassion, UIHC, and Mercy Hospital. As we begin our next decade of care, we will continue to provide needed care for the uninsured and underinsured in our community. We will help patients navigate through changes in healthcare reform. We'll continue to do our very best to meet our patients' needs. We would like to expand services for patients diagnosed with chronic conditions. We would like to expand our dental services, and we'd like to explore adding mental health services to our scope of care. We also hope over the next 3 years to make improvements to our lower level so that we can provide direct patient care on 2 levels rather than 1. Most importantly, we will continue to work with our incredible community to do our very best to keep our mission going strong.